Good morning. My name is Karen Scharf. I'm the Executive Director of Citizen Action of New York. We're a statewide grassroots organization, and one of the many things we do is organize consumers around healthcare issues. And with me here today are AARP, Statewide Senior Action, and NYPIRG. We're here today to announce the opposition of many organizations from all across the state, representing community members, consumers, seniors, healthcare advocates, the disabled, and other average New Yorkers who are seriously concerned by the proposal to severely limit the rights of patients and endanger patient safety. I'm referring to the proposal to cap so-called non-economic damages in medical malpractice actions at an extremely low $250,000 level. Non-economic damages, this means physical pain and suffering, emotional distress. These non-economic damages compensate severely injured people for the real personal harm they suffer when a doctor, hospital, or other healthcare provider makes a serious mistake causing them physical injury. Although this proposal came out of the Medicaid redesign team, it's important to say that this is not about saving money for Medicaid. It uses the need for savings as an excuse to cut the rights of severely injured patients, including women, seniors, and the disabled. I'd like to first point out that this is really a kind of a solution in search of a problem. Despite the distortion campaign by the medical industry and hospitals, New York's effort to study this issue through a medical malpractice task force set up by Governor Patterson that we sat on found that medical malpractice lawsuits are decreasing in New York, not increasing. And most importantly, there's a pretty simple, obvious solution. Stop committing medical malpractice, and you won't have medical malpractice lawsuits. Improve patient safety. And this is not just a vague idea on our side. There's been study after study showing that with proper training, communications, staff, and staff structures, you can significantly reduce medical malpractice. In fact, just in February, the American Journal of Obstetrics and Gynecology reported that at New York Presbyterian Hospital, Weill Cornell Medical Center in New York City, by implementing basic patient safety measures, they were able to reduce obstetric-related malpractice payments by 99%. Now that's not a misstatement, it's 99% reduction in malpractice payments by basic patient safety measures. They were able to reduce their liability payments on obstetric malpractice by $25 million a year. And most importantly, they were able to reduce the death by mothers in childbirth. And that's really the bottom line for us as consumers and representatives of patients, is that when we look at medical malpractice, our goal is to have less malpractice and less injuries. And the civil justice system, the opportunity to sue, is one of the few things that allows victims to get compensation, but also gives providers an incentive, a financial incentive, to reduce their malpractice occurrences. And that's exactly what New York Presbyterian Hospital did. They wanted to spend less money on malpractice, so they reduced the incidence of malpractice. There was a second recent study also in the same journal showing similar results at a hospital in Jamaica in New York City. And NYPIRG did a recent report that also showed that there's a small number of doctors responsible for a high percentage of malpractice payouts. So basically there are simple solutions. Increase patient safety by putting basic patient safety practices into place, and discipline the worst doctors to get them out of the field so we're not having to have as many malpractice incidents. And just as importantly, as other speakers will discuss today, caps on non-economic damages are discriminatory. They discriminate against women, seniors, people of color, and the disabled. That's simply because these individuals typically don't earn or have the prospect of earning high economic damages because of future lost wages, because they're either out of the workforce or earn less. Women, seniors, and the disabled must therefore rely on non-economic damages, like pain and suffering, to compensate them for their real economic harm. And in today's world, $250,000, the proposed cap, doesn't compensate, to say the least, for a lifetime of injury and inability to work. Instead, we should leave it to the jury system, which has worked for centuries, to determine what people's real loss is. As of today, the letter that we're releasing today already has over 25 groups signed on, and we're signing on every day. And as our letter says, New York must reform Medicaid, but not by limiting the rights of injured patients and placing an unequal burden on communities of color, women, seniors, and the disabled. We'd like to thank the Assembly for rejecting this bad proposal so far, not including it in its one-house budget bill, and we urge the Senate majority and Governor Cuomo not to ram this bad proposal through the budget process without a thorough examination of its consequences for average New Yorkers. I'd like to now have a couple of the supporting groups here speak. First, from AARP, Shirley Bristol. Shirley?
Good morning. I am Shirley Bristol, a volunteer leader with AARP New York. We are here today to tell our state elected officials that severely limiting someone's ability to recover damages is unreasonable. Imposing this cap on pain and suffering will hurt many people, particularly seniors. It would be much harder to obtain justice when someone is being injured by the mistakes of others. AARP believes this cap would mean those who cause injury would avoid being held fully accountable for the pain and suffering they have caused. Capping damages for pain and suffering, particularly for a vulnerable older population, sends the message that individuals can be harmed by the negligence of others without any serious financial consequences. We cannot let this happen in our state. AARP strongly believes that a final budget should not include a cap on pain and suffering caused by medical negligence. Thank you.
Thank you, Shirley. Mike Burgess, Statewide Senior Action.
Statewide Senior Action has for many years had a patients' rights helpline, and patient safety is something that the organization has really been concerned about all these years. You know, we hear stories about people who are having problems with the healthcare system many times, and while most of the providers and professionals in healthcare do a good job, and most people do find there are errors, there are mistakes that are made, there's carelessness, there are problems. We heard about a person recently sent home at 2 in the morning in an ambulance just to send them home. I mean, and not dealt with, and ended up being readmitted to the hospital. So what we're concerned about is that there are proven methods of improving quality of care, and this process, this insider process, did not really focus on improving the quality of care for people. So what emerged here was not something about patient safety, it was more about institutional financial safety. That's what this group was all about. And placing a cap on awards doesn't improve the quality of care we need. So we're here as a group of people saying, we were left out of this process. And now it's time to have an intelligent debate and discussion about it, and listen to the other side of the point of view about what happens when there are mistakes made. Let's put the focus again on the quality of care and patient safety, not on taking care of the people who sat at the table who were appointed.
Thanks, Mike. Blair Horner, NYPIRG.
Good morning. When the governor appointed the Medicaid redesign team, we thought naively that they would be focusing on Medicaid. Instead, they came up with a proposal that affects everyone. Under the governor's proposal, the $250,000 cap applies to every single New Yorker, no matter what their income. We think it's we were shocked to see that the Medicaid redesign team came up with that. And they came up with a cap of $250,000. Where did that come from? Why not $50,000? Why not $50 million? Where did the cap come from? It came from the industry's demand in its negotiations with the governor. This is a backroom deal between the governor and the healthcare industry to come up with a number that they believe will save money. And when they talk about savings, which you hear about all the time, let's not kid ourselves. Where do the savings come from? It comes from horribly injured consumers and is transferred to hospitals and the wealthiest professionals on the planet. It hurts people that suffer non-economic loss, that just don't have a lot of money. And you heard who they are: seniors, children, poor people. And so it's a backroom deal. We don't like it. In fact, the impact on real people can be devastating. So we agree that the focus should have been, and should continue to be, on reducing the injuries. People don't file lawsuits if they're not hurt. And the best way to deal with the problems of medical malpractice and doctors' insurance premiums and hospital costs is to make sure that people don't get hurt in the first place. Thank you.
Thank you, Blair. As other speakers have said, and as Blair just said, the main point here is that if we're concerned about patient safety, we would reduce medical malpractice through basic patient safety, staff training measures, and discipline of incompetent doctors, not by taking away victims' rights to compensation when they've been severely, severely injured. And we're talking here, when we're talking about these caps on non-economic damages, we're talking about people that have lifelong injuries that they're never going to recover from. And that's why they're in court, that's why they're suing, and that's why juries are awarding them more than $250,000, because a jury who's evaluated the evidence, looked at the situation, has come to the conclusion that that's what people are going to need in order to continue to live their life and go through rehabilitation, do the other things that are going to be necessary. And have this kind of proposal, come out as though it's a Medicaid proposal, is one more example of an Albany backroom deal, and is not something that any of us, would have imagined would have come out of that process. So, questions? Thank you very much.
Good job.
Good.
Good job, Shirley. That's good.